Acknowledge the traditional custodians of the lands and seas on which we live, work, and pay our respects to elders past, present, and future. And introduce VisionFlex single member today is just Daniel. So Daniel is here part of your telehealth uplift grant, so part of the NKindle process. Kieran is part of our team. You've met Kieran in previous meeting. The telehealth carts are arriving slowly but surely, and they're being implemented. But I will hand better over to Kieran and Daniel. Daniel's going to give us a solo demonstration on the telehealth carts.
Thank you, Kieran. Thank you, Darinka. And hello, everybody. Welcome, and thanks for joining. So I'll just quickly bounce through what a session would look like with one of the carts. So you can all sort of a bit of breaking of the ice, put a toe in the water to see what's going on with them. I'm going to use this bigger screen for the demo, but this is what your carts look like. It's got a laptop in there, and you've got the patient-facing monitor sitting over there. And there's another HD webcam up the top. So there's a camera on the laptop that will be looking at the RNs or whoever's using the cart. And that camera will be pointed at the resident, and that screen will be pointed at the resident. And then I'll show you how you'd bring a doctor's face and put it onto that second screen so the resident and the doctor can have a really good one-on-one interaction. So let's do that here on this one, just for the sake of this bigger screen. The good thing about the laptop card is it's a bit more mobile. You only need to plug that other monitor in. It's a lot quicker. With this one, it needs to be plugged in all the time. You need to have this screen powered as well. So what it looks like is you would turn the card on in the morning, you come to our VisionFlex website, you log in, and that's going to bring up your vision options here. So you could create a meeting for the future, or you could jump straight into a virtual room like this, as I'm doing so now. And then here I am sitting in my virtual room by myself. So what I do now is I'd click the plus button here and just add a guest and just put the email in, hit enter. Whoever gets the email clicks that and they're straight into the room. Their face would pop up as well, as long as I got a camera. And then you're off and running, having an interaction. What you'd want to do then is get the doctor's face onto that second screen. And that's just a matter of clicking this button here and clicking the second monitor there. And you'll see how that screen's now lit up. So you'd have the doctor in here, you put their face up there, and that's pointed at the resident, and they can have a one-on-one with the doctor. The next piece of the puzzle is to bring the software into the picture. And that's where we can start using all of our devices. So to do that, you just click the software icon option here, and that brings up the ProEX software. And you can either have just an admin in here. We suggest adding in maybe an RN account. You can decide amongst yourselves, does every RN want an individual account, or do you just want them all to use the same one? That's a discussion for another day. So 1, 2, 3, 4, our very lax security, you can change that. So here's where we could go into a new patient and load or maximize that. Here's where you can go put a new patient in, or when you've got some patients in, you can go and open the patients up and have a look at them. Or if you want to jump straight into an exam mode, it might be an emergency situation, you want to get a doctor in and look at someone immediately, you click into here, and it's going to bring up all the different options we've got here. So, as I said, temperature, it's all Bluetooth. Blood pressure machine, again, Bluetooth. Pulse oxy, and the thought of getting this a bit quicker today instead of waiting, I've already done these this morning, and they're all up in the gallery here. So blood pressure was 132, my temperature was 36, pulse oximeter was at 97, and I'm telling you all I'm 70 kilos, but we know that's a lie. But anyway, I will show you though, this little option here is the camera section. So if I press onto that, that's going to hopefully bring up this camera I've got in my hand here. So you can all see yourselves on the screen there. Where this really shines though is up close. You can take some really high definition images of skin and any wounds and anything you want to take a picture of. You can also take some pretty serious eye images, which is not as painful as it might look. and you just capture the image there. And that's another observation that's gone up to the gallery up here. Oh, I tell a lie, that one didn't happen. That's weird. I'm just, oh, it's kicked in, good. So you can see that's in there as well. There are other things you can do with this camera. There's another attachment here that has, you can put a tongue depressor into it. I'll save you from looking down my mouth today. And there's also a wound reference ruler that you can use to be taking images of wounds and things that are at a distance. So the intention is that's obviously the same distance all the time. You can determine if something's improving or not over time as you monitor things. So that's essentially the nuts and bolts of what a session might look like. And there's also there's ultrasounds, there's otoscopes, there's all sorts of other devices. There's ECGs. That's really powerful. But again, for the sake of time, there's videos on that too on our website. I can show you all those. But what you want to do now is go into the gallery and determine what you want to keep as a final report you might want to put in your patient management system. So they all look good for the report. We just save the session, existing patient. I'm Daniel, so I'm just going to go against me there. I'm going to save that session against me. And there it is there. So you can put my sex and my age and patient's notes about anything you want to put in there. And these are past sessions I've done in demos to show people. So you could compare today's, last week's, the weeks before, and run it all in one report and email it out to anybody, or put it in the patient management system. And then you can compare. But let's just have a look at today's one. I'm just exporting that to PDF, up to the downloads folder. So save it anywhere on the computer you want to, obviously. And you just browse to where you've saved it. And here we go. So that's our site there. We'll change that to all of your individual sites. My name, gender, date of birth. And here's the exam we've just done. So pulse oximeter's there. There's a picture of my eye. Temperature, weight, and blood pressure. So it's as quick and as simple as that. It really couldn't be any easier. As I touched on the carts, we include PDF guides with exactly what we've done and how the cards work. So it's a really good reference to go look at. So have a look at this beforehand, have the training with us, do some demo sessions with the staff and with whomever you want to. And this is a really good resource to go and have a look at as required. But also on the desktop, we've got support links for you. So you just go to the Vision site and up in the support, everything's here. So you can book more training, any issues with the card, you can log a support ticket, and training guides and manuals in here. There's we've just completed these 2 videos and they really step you through exactly what the card does. So it's nice and easy. Here's a really good video on how to use a stethoscope. It's a little art unto itself, the stethoscope, because it's a really powerful microphone. So you need to watch that to be able to learn how to do that. It only takes a couple of minutes. More videos on how the cameras work. And here's some really good videos for the doctors, the remote doctors, to have a look at. So you can email this out to them. They can have a click of that, and that pretty much explains. They literally just sit there and guide you guys on what they want to look at for the resident. And then it's obviously all sorts of PDFs for the different types of cards we have. So that's pretty much the nutshell. I'll stop now, Kieran and Doringa, and if you guys want to take back control of the meeting, but I hope that's a bit of a breaking of the ice for everybody. Any questions you want to ask me, please do.
Questions from the RACH managers?
Sorry, I missed that.
No, that was for the managers in attendance. Did anyone have any questions about the carts that are coming out to you guys? Kieran, I'm not sure what the time frame for Mackay area is.
Just briefly, let's see. I think I've reached out to Proserpine first, and I think I saw them in the call here that because they're closer to town, so I can drive out that way. And then I think the following week is going to be Mackay proper. Now I've got Proserpine's cart arriving. Let's see.
Sorry.
possibly late next week. We're just finding out how long freight is sort of starting to take and that sort of thing. So it might be Thursday, Friday next week, potentially Monday, Tuesday the following, depending on how that goes. And then the week after that, I believe we've got, all of our lovely, the rest of the Mackay sites all seeing it. And what I'm trying to do is within the following couple of days after the big box arrives with the thing, is I'm trying to get out to you guys and actually just more or less assist or even take care of the assembly of the cart, and then just go through some of the basics about what you'll have to do to get it onto your Wi-Fi networks, and hopefully you can action that in advance of basically Daniel and Buddy Abe dialing in and delivering a proper formal training session on the thing, and everybody gets the chance to really go through the guts of making a call.
Yeah, absolutely. If anyone's got any questions as well, support@visionflex.com. Please feel free to email Abe or myself, and we'll loop Kieran in as well. So we're here to help. Our jobs are to make sure you guys are all happy and okay. So as Kieran said, we'll all join together and make sure you get up and running and happy and using it. So there's a couple of things I do want to please drop on you all. If you're having your IT involved with the carts, which we recommend you do if you can, you've got the opportunity, tell them to please treat the cart like any other computer on the network. Some security like any other computer, as much bandwidth as you can give it, because obviously the video meetings sucks up more bandwidth than normal. And your patient management, I think it's eCase we've settled on, you guys use. Am I correct there, everybody? Is everyone different?
Everybody's different.
Perfect. But again, if you can get the IT to, as I said, treat the cart like any other PC, so get the ability for all the staff to be able to log into the PC, to their own profiles, get whatever your patient management system is installed on it as well. And then if you start using the cart like an everyday thing, this telehealth stuff is just a bonus on top as well, so you can jump in and use that when required. I just wanted to get that across. Thanks. Sorry, Karen. I'll let you.
I just have a question, probably more so for PHN. Are specialists taken to the idea of having this?
Sorry, what was the question?
Because people have to go to specialists for right check, whatever. Are they willing to use telehealth, like the local specialists?
So so it's from both sides. So we're encouraging our GPs and our specialists to get involved. Maria, I can see you jumped on.
The idea is if we could have the residents or the RACH managers to actually convince that the specialist appointment will be done by telehealth, it will help us to encourage the specialists to also have their buy-in in using the telehealth option, because that would just help with time and efficiency for both parties.
It will be very good for us. The other question I had is it for public only, or public and private specialists?
Absolutely for both. If you could encourage both public and private specialists to connect with via telehealth, that will be fantastic.
Thank you. And you will be encouraging them too, obviously.
Absolutely, yeah. We will have a communication drive to encourage general practice specialists and HSS's enriched team to do exactly just that.
Thank you.
So you might find doctors, we've seen in our rollouts, some doctors really embrace it, and they can be anywhere. So if you guys can start collating lists of which specialists are keen to use it, which GPs are keen to use it, you might be able to shop around and share with each other, you know, different doctors and different specialists. And yeah, the more, as I said, this is the beginning of this process for everybody. So it's going to be a slow upkeep of getting doctors and specialists involved. So
I
work
want
as
to
a
chime in
team.
here and
Yep.
just provide a little bit of assurance in that it's not a hard sell when you're going to make you know, these appointments for or on behalf of your residents, or they're making their appointments. Really, it's just an invitation. Hey, can we do this via telehealth? The doctors don't need, and even family members or whoever we're extending to be in this telehealth call, no one needs any software installed, no one needs any package or any know-how or anything like that. The package we've got here, the Vision package, and any other platform you use, it has a capacity. It sends out a link via email or SMS sometimes, and the doctor just clicks that link and they get taken to a website where the call happens. Even if they've never done telehealth before, it's very accommodating. All they do is just click and they're in, and they can try it.
Yeah.
Mm.
And like you
And
guys
Danny,
did today, you literally just sit there and watch. Yeah. The doctors.
Sister, we also are actually really toying on the idea that we could have or we could piggyback on one of your morning teas or lifestyle coordination events, and we can piggyback a show and tell.
That will be lovely, I think, because sorry, I wasn't here from the beginning, but I know I heard you saying, do you involve all the RNs or do you involve management? Or I think all the RNs need to know about this.
Absolutely.
Because yeah. So that would be lovely if sort of we can have a show and tell with our staff.
Yeah, and also to the residents, because then if it's the residents' choice, if they understand how the telehealth works and what's in it for them to request to their GP or to the specialist to actually do the appointment by telehealth, that we need to let the residents understand what's in it for them, and then they will. Then there's no more convincing than the residents actually requesting for the appointment to be by telehealth.
Because in all honesty, you would understand as much as I do, it's such a struggle to take someone in an ambulance or even wheelchair taxi, then they have to wait 4 hours for a return.
Yeah.
It's very, very inconvenient. Sometimes, which is happening more and more, they don't have family members to take them, so we have to take someone off the floor to go with them.
Yeah,
transport. So
transport.
Exactly, it's convenient in every angle if the doctors are willing to accept it.
Yep.
Perfect.
Thank you.
Yeah. Yeah, we've rolled out some of these carts to some of the most remotest places in the country, and yeah, it's been so helpful. So even metro, rural, out the back of nowhere.
And
I
following
suppose
on,
the other thing is, sometimes it doesn't happen very often, but if someone have a wound that the hospital need to see regularly, are the wound clinics at the base hospital open to the idea?
we can get in contact with them. So
because
like
from what we're
the
seeing,
RAS.
like they would be able to see the wound as clearly as.
I have heard of, you know, people doing the telehealth on online and using the photographs, and this way they actually monitor the photographs over time. But I can check in with the RAS team, and well, we don't have anybody online. I think today I've got some apologies, unfortunately. Unfortunately, I've got an apology from them today.
But that's okay. You can always
Which is a shame, actually, because then we could have asked them, unless there's somebody else online. But I'm pretty sure.
Jenny White is online.
Oh,
I think Jenny has something to do with that, isn't she?
Jenny, did you have any input on that? But I wasn't sure.
I can. I'm not really sure. I can ask some questions and get back to you. I think it would be the RAS team that you would talk to.
Yeah, yeah, that's what I thought.
But I think, as like Sister Pauline was saying, as far as the wounds are concerned, it would be great if we could do that.
Yeah, So I'm pretty sure those photographs are quite clear, and they can at least give a starting point indication.
Absolutely. And we've been rolling these out across all the different states, and a lot of the PHNs are interacting with the different governments in each state. And Victoria put in a good way for their carts to be able to connect to the emergency services. Western Australia is starting to get something in that space as well. So yeah, I can highly recommend if you guys can have a chat with the relevant people in your ends. It's been really helpful. So absolutely.
Another question for you, and sorry, I don't know your name because me and names are incompatible. I forget names too much. But I saw you taking a photo of your eye, and it looked like you didn't flinch. You know,
No,
usually.
It's not very. It looks bright, but it's fine. Every single demo I do, after I go through it, I say to after we take some pills, I say, now be brave and put it up against your eye. I promise it won't hurt. And I had one person who goes, I've got really sensitive eyes. I said, just trust me, I promise. And sure enough, up it went. Took a nice picture. So
that's amazing. Like, you know, to
Yeah.
have such a clear picture without blinking.
Yeah, it's really good. There's also on the side of the camera, there's some, so it auto focuses, but if there is any issues, you can actually turn the light down or up either side
yeah.
there, and that's a zoom in or a zoom out. So sometimes with the oral exams, the camera might focus on the lips and you want to get it in the back of the throat, so you just sort of zoom in or zoom out until it works. And then when you want it to go back to autofocus, you just unplug it, plug it back in, and just kick straight back into autofocus. So really powerful. Yeah.
Excellent. Thank you.
Some really cool toys connected to these carts, and we're finding, yeah, those cameras for wounds and everything are going to be the most popular. But yeah, I think, yeah, the stethoscope and the ECG that are rolling out primarily with these carts as well, and all very powerful equipment, all very fun toys.
Yeah. And if you want to go to the VisionFlex site and have a look at that stethoscope video now, just so you can understand what it is, yeah, it only goes for a couple of minutes.
Not right now, but after our meeting, you're very welcome to.
There's the ECG. So something else you can get. That's literally there's a connector there and two there. As long as your fingers aren't touching, you just press the button. It takes 30 seconds for it to load up, and you got an ECG ready.
Did you want to type that into the chat?
I'm just in the process of getting those links. I'll
lovely.
drop them in so everybody can visit after the meeting.
Thank you very much. That'd be great. Any other questions from anyone else? No? That's wonderful.
Support at VisionFlex. Yep, sorry.
You will be seeing VisionFlex a few times and over the next few months, and yep, they're there to ask questions. And look, we had a question raised about Starlink as a Wi-Fi for facilities that have issues with Wi-Fi. So we're actually going to maybe have a little bit of a look into that as well and provide some information for those that have issues with Wi-Fi connection. So, but you've all got your reports, and there are the homes that have the Wi-Fi issue understand those issues. So we'll get back to you on that. Yes. So thank you again, Daniel. Appreciate your time. It sounds like facilities might actually lose some staff members. If you're missing your staff member on the floor, it's because they're playing with the new cart.
Yeah. Again, it's perfect. Support at visionflex.com. I'm literally here to help you all. So reach out, any questions. And as Kieran and Darinka said, yeah, some links are coming. But yeah, thank you all as well.
Wonderful. Thanks again, Daniel.